Welcome back. A few years ago, we invited a group of leaders of medical associations to come to London to a meeting at BMA House on what medical associations and doctors could do on social determinants of health. And after a good day of meeting, I was leaving BMA House, walking north up the street to Euston Station to catch the underground train home. And it was about 9:15 in the evening, and people were bedding down for the night on the portico of St. Pancras Church. And my first thought was really stupid. I thought, it's only 9:15. What are they doing going to bed so early? And then I thought, if you're homeless, what else are you going to do at 9:15 in the evening? The next morning, I went back to this meeting of doctors and medical associations and said, is that any part of your responsibility? The fact that people might be homeless, and that clearly is going to harm their health. Or indeed, that people do have homes, but they're insecure, or they're of low quality, or they're unaffordable. Is that any part of your responsibility? Because they have big impacts on health. Often I get asked, we produce a report, what's the one thing that you would recommend? And if I'm in a disagreeable mood and I'm asked one thing, read our report. But people want to know, well, which is it? Is it poverty? Is it housing? What's the thing you would do? Well, they're closely related. At the workshop on racism, I pointed out that in London, 17% of children are in poverty before housing costs, 32% after housing costs. Housing is a cause of poverty. Poverty is a cause of poor housing. The cost of rent is a cause of poor diet. Cold homes damage health. Why do people live in cold homes? Because of poverty, because of the quality of housing, because of the cost of fuel. So these things are closely interrelated. But the question is, where are you going to intervene? And we think that one of the areas we should intervene, not the area, but one of the areas is on housing. And I think Jessica will talk about it. We're going to publish a report on housing and health and what developers can do. Developers, wow, could we bring them in? Could they be the good guys rather than the bad guys? That's a stretch of the imagination. Well, we're going to encourage them to be the good guys of what developers could do in this arena to be agents for change that could lead to better health and greater health equity. So that's what the rest of the morning is going to be about. And to kick us off, my wonderful colleague, Jessica Allen, who's been leading on this report on housing and health, will talk about the health side.
Thank you, Michael. I believe... So, some enormous challenges facing us. We're all well aware, only too painfully aware. Deteriorating health, widening health inequalities, the environmental challenges, crises, increasing poverty. And in this session, we're going to explore the role of housing and places in influencing and potentially ameliorating some of those challenges. To start with, the scale of the crisis in health in England. This is showing life expectancy. Since 1999, you can see prior to about 2010, life expectancy was increasing about 1 year every 4 years, and we got used to those increases. And then you can begin to see this levelling off, this stalling in increases in life expectancy. And we've previously written fairly extensively about this and about how that's associated and the result of policies of austerity. So the cuts to public spending, the cuts to local government, the cuts to services have really impacted quite dramatically our health. You can see the dot at the end, and that's COVID, which led to a decrease in life expectancy. Pretty bleak overall picture, and when you look at the inequalities, it's even more concerning. People in the most deprived areas, this is the bottom 10%, the most deprived 10% of areas on the left-hand side of this graph, men in blue, females in orange, and the least deprived on the right-hand side. And you can see this is over a 3-year period. 6-month decline in male life expectancy over that period. We do not expect to see these declines in life expectancy in peacetime. Some very, very dramatic and concerning changes in life expectancy. And we've recently also calculated what it would look like if everybody had the life expectancy of the most deprived. And we calculated, if that were the case, we would have seen 1 million fewer deaths over that decade, 2010 to 20. 1 million fewer deaths. So inequality, deprivation, discrimination, leading to that enormous loss of life. Regional inequalities, also of serious concern, and getting worse. So you can see this is showing inequalities within areas. 2010 to 12, the Northwest region not only had the worst health, but also the biggest inequalities in health. And look what happened, 27 to 19. The Northeast, now the most unequal region, but inequalities have got steeper everywhere across the country. So the government has committed to reducing inequalities in healthy life expectancy, regional inequalities, by half. It's enormously challenging. This is healthy life expectancy, how long we can expect to live in good health, and you can see again deteriorations in healthy life expectancy, and here are the inequalities. They're even steeper than the inequalities for life expectancy. Most deprived, on the left-hand side of this graph, could expect to live in good health to around 50. Wealthiest 10%, least deprived areas, 70. 20-year difference in healthy life expectancy. And if you were to break this down further into, say, 5% groups, you would see an even steeper gradient. I've mentioned the cuts that have been experienced over the past decade and ongoing, and what that has meant for our health. Here's a very shocking, I think, demonstration of the impact of those cuts. Life expectancy across the bottom. So we looked at life expectancy, is this male or female? I think it's male life expectancy in 2010 across the bottom. So lower life expectancy on the left-hand side, higher life expectancy on the right-hand side. The cuts to local government, 2010 to 2012 to 2019-20, and you can see that the areas with the lower life expectancy, those more deprived local authorities with greater need, worse health, have experienced much greater cuts from national government. So it's a neatly regressive line. So either this is on purpose or it's accidental, but in either case, it's unforgivable really, because of the impacts that has had on all our health and the length of our lives and the quality of those lives. So housing. Housing is an enormous influence on our health. We all know that, but this is an analysis from across the EU, which is showing just how much of healthy life expectancy, or self-rated health here, is shaped by housing. 20% if you look at housing deprivation and fuel poverty. You could reduce those inequalities in healthy life expectancy by 20% if you were to improve housing. Material deprivation, 35%. That's poverty. Of course, all these factors are interlinked, but you can see how enormously significant housing is to healthy life expectancy. Many health impacts on our directly on our physical and mental health. I haven't included the data. We've written about this previously. There's a lot of data behind all of this, and I think it's really important for those of us making the case about how housing impacts on health that we have that data. But we can see that cold, damp, and increasingly hot homes directly damage our physical health, lead to increased mortality and worse health, overcrowding, unsafe homes in poor condition, and places as well. Air quality, access to green spaces, community cohesion, crime, access to services, all profoundly influencing our health, and place shaping, very, very important here as well. The economic impacts. Poor quality housing damages our health, which is in turn leads to greater unemployment, inability to work, harms the productivity of the country, the economic capacity, bad for business, bad for all services, and of course it leads to increased demand on services and increasing costs within those services. So, just a very brief overview of some of the dramatic impacts of housing on health. Who's most affected? Most of the poor quality home, not all but most, is in the private rental sector. Very difficult to regulate, inspect, and enforce quality housing standards in the private rental sector, but the social housing sector too, and we'll come on to that in a moment, also in some of the new builds as well. Older people, young people, I mean, I've just picked some here, but we know that most people are affected by poor quality, unaffordable housing. And racism within the housing sector, very prevalent. As Michael mentioned, we've just reported on structural racism, ethnicity and health inequalities in London, as racism within the housing sector, private rentals, social housing. And you can see here, percent of Londoners living in overcrowded accommodation by ethnicity, much lower among white groups than among mixed Asian and black. Homelessness. Again, you can see this breakdown. You may not be able to see the detail here, but Indian, Chinese, white groups at the top of that graph with much lower homelessness. So this is also a problem of discrimination, and it's some of the outcomes of racism and discrimination, at least in London, and I'm sure we'll be looking in other places as well. So, what to do? Bleak context, as I said, but we've been enormously encouraged by our marmot places, over 50 of them, and more coming along. And increasingly, these areas are prioritising housing and making links with housing. We'll hear from Leeds and Manchester shortly. Incidentally, when we did the 2010 Marmot Review, housing was not nearly such a concern. In fact, we only mentioned it or referred to it quite briefly, and now it's an absolute priority, which gives you an indication of the trajectory and the impacts on health. So these areas are doing what they can to try and improve the quality of housing, the affordability of housing. It's challenging. You saw the cuts to local government. That joined-up working is challenging, especially among stretched budgets, services being cut. There are ways forward. Selective licensing schemes show some promise. There are decent housing standards, lack of enforcement because of the cuts. But still, there are principles there and some areas taking action. There are some things that can be done about affordability and the supply of housing. Of course, we know that there's just a lack of supply of good quality, affordable housing across the country. And that's where we've been looking at the role of the developers, who are, principally the house builders in this country now and will be for the foreseeable future. We are going to be producing this report in the next month or so. We've been working with Legal & General and the Quality of Life Foundation to assess what more developers can do, the whole development industry can do to provide those affordable, good quality homes and shape healthy places. We'll be looking at quality, affordability, supply, and in relation to place shaping of new developments, access to services, the composition of those communities and places, intergenerational, mixed ethnic groups, mixed income groups, families, single people, and so on. And then, of course, environmental sustainability, trying to mitigate and reduce greenhouse gas emissions and ensure enhanced biodiversity. So, we'll be looking at the role of development industry and testing out how far we can ask the development industry to develop these houses, these places that we know that we all need, and looking at the environment in which they're operating. So the policy environment, the legislation, the regulation, the levers which the development industry operates within, so those ESG frameworks, the standards, the codes, and so on. And more broadly, we're hoping very much that as a result of this work, we'll all be pushing forward all the stakeholders who are involved, and including the developers, in this endeavour to build healthy and more equitable homes fit for the future. Thank you.
Thank you so much. One thing that I didn't say that's so obvious of what housing means to people. The sociologist Anthony Giddens in the past used the phrase ontological security. I'm still trying to figure out what he meant by that. But what I think he meant is think what it means to come home. What does it mean to you to have a home? And if that home is dangerous, overcrowded, inadequate, cold, insecure, it doesn't mean the same thing at all. And so what we're talking about is pretty fundamental to people's psychological well-being as well as their physical well-being. And that underlies everything we do. We're talking about real basics here, real basics: food, shelter. The Joseph Rowntree Foundation, in their index of destitution, talk about doing without housing, heat, light, food, clothing, and toiletries. 1 million children doing without 2 or more of those. So this is pretty basic. Housing is literally where we live. Cordell, you've talked before, I'm going to ask you to talk now about making Manchester fairer. I wonder if you would also say, when we did our report, it was for Greater Manchester, which is 10 local authorities, that the City of Manchester, delighted, is taking the lead with Fairer Manchester. Could you say something in your remarks about the other 9 local authorities? What's good? It's not your responsibility, but what is happening in the rest of Greater Manchester?
Thank you. Put on the spots once again. Hi everyone, I'm Cordella Forey. I'm Director of Public Health for the City of Manchester. There is lots of work happening across Greater Manchester, across all of the other 9 boroughs, and my DPH colleagues in those boroughs are all in their own different ways prioritising different work to address health inequalities. In Manchester, our plan to tackle health inequalities is called Making Manchester Fairer. This is my first and last slide, you'll be pleased to know. That doesn't mean that I will only talk for 2 seconds. Alan's going to keep an eye on me. So, Manchester is probably one of the best places in the world to live. And you're going to say I am biased, however, Time magazine a few years ago did say that Manchester was voted the 3rd best city in the world to live. It's amazing. Sport, 2 great football teams, whether you're red or blue, 2 great teams. Music, museums, culture. The LGBTQ community have made it a place of sanctuary and pride for decades. It's diverse. Over 200 languages are spoken. Great place to live. It's really young. Our working age population is increasing. People come to study. They become adopted Mancunians. They never leave. But there's another side to that story, isn't there? We also have challenges. So we are the 6th most deprived borough in the country. The life expectancy gap between the most and the least deprived areas is 8 years for men and 6 years for women. We have 47%, in fact 47.9% of our children are living in poverty. 52% of our population are from racially minoritized communities. That means, in addition to the statistics that we know about poverty and employment and housing, they're also going to face structural discrimination and racism that has an impact on their health. So, we set up Making Manchester Fairer to tackle these building blocks, foundations, root causes of health and health inequalities. And in the plan, it's got what you would expect. You know, we're also kind of a marmot city. There's 8 themes. You can predict what they'll be: children and young people, tackling poverty, employment, preventing ill health and early deaths, homes and housing, places, environment, sustainability, communities and power, tackling structural racism and discrimination. 8 themes. But I often say that the how we do that is as or more important than the what. We need to take a systems approach. Michael spoke earlier about how nobody can do this on their own. No one organisation or agency or sector or group can do this on their own. So the way in which we're doing this needs connection between the themes so that our whole will be greater than and different to the sum of the individual parts, with creativity and collaboration between different sectors, agencies, organisations. There are 3 things that are really important and underpin the how that we are doing this. The first one is about community power. The second is about tackling poverty. And the third is about tackling structural discrimination and racism. So in terms of community power, we have thought very, very deliberately about how are we going to make sure that our local communities and residents have a voice and a say and can be involved in the ongoing development and delivery of the plan. And I haven't got much time, so I will only give you one example. So we've really wanted to embed community voice and lived experience into the governance, leadership structure of the programme. And to do that, we set up something called the Making Manchester Community Forum. And I'm really pleased, I said I would name drop him, Rich Browning, wave, from Healthy Me, Healthy Communities. So that's a local voluntary sector organisation. And they have been funded to create this forum so that in terms of trust, it's not local government or the council doing it. And we've identified 16 people from the local community who reflect the diversity of Manchester's communities. And the way we went around identifying those people was done in a very, very deliberate way to make sure that that group of people was really diverse. So as a result, we have disabled people, we have people in their 50s, we have young people, people with long-term conditions. Over half of the people are from racially minoritized backgrounds. Only 38% are white British, which is kind of similar to the proportion in terms of the demographic of Manchester. So the deliberate effort we've made has worked. And what we're doing now is connecting that community forum to the board that also had a deliberate recruitment exercise to make sure that at the very top of the programme, we're going to get community voice in there. Anti-poverty, poverty cuts across absolutely everything, as we've really heard. So that's a priority. The council had an anti-poverty strategy, so rather than that being a separate strategy to making Manchester fairer over there, scarily now, I'm now responsible for anti-poverty. Try not to think about that. However, and the anti-poverty strategy has been integrated into making Manchester fairer. So in terms of that bit of joining up the dots between the different themes, we're all working together. So for example, a piece of work has happened around poverty-proofing the school day. And a toolkit has been produced for schools to identify the barriers that their pupils and families might face to accessing their education as a result of poverty, and the role the school can play in addressing that. The third one, tackling structural racism and discrimination. But again, thinking about how we influence all of the partners having impacts on health. So as an example, we developed and delivered a race and health equity education programme. And in the first year, 75 partners from a range of sectors, not just the council, including housing, education, have spent a year on this programme to learn about what is racism, why and how does it have an impact on health? And crucially, what can I do differently to do something about it? So those three things are underpinning everything that we do in the programme. So I need to talk about housing, don't I? Where we live determines how we live, or as my head of comms puts it, where we live is how we live. And we know how we live impacts our health. Are there any frontline workers in the room? Anybody who works directly with the public or patients, clients, and any kind of support? I can see some hands in the room. So if you do any kind of frontline work, you often have those clients or patients or people that you've worked with that stick in your mind. One of the patients that sticks in my mind from when I was a GP a really long time ago had a whole range of social problems that were affecting both her mental health and her physical health. And the bit of her story that never left me, I still remember her sitting in the consulting room and her saying, there's this hole in the floor in her house. And I was trying to picture what this hole looked like. Hole in the floor, she trips over this hole, hurt her back, and she keeps trying to contact the landlord, and the landlord won't do anything about it. And she's really worried. And there were lots of other things going on that I won't go into, but the hole in the floor stuck. And she was always pleading with me to do something about it. And I couldn't, even though it was affecting her health. I framed housing health into three themes. Three is easy to remember. There's also a bit of alliteration to make it easy. So, access and affordability. That really basic need for shelter, basic human need. Safety and security, also a really basic human need. This is a bit of a cheat here. Quality and conditions. In Making Manchester fairer, our fifth theme is about improving housing and creating safe, warm, affordable homes, doing something across each of those three themes. In the plan, each of the themes had 5 actions. So housing has 5 key actions. Under housing, we've talked about creating 10,000 new homes, including affordable homes, with a real focus on North Manchester, because if you look at that map there, many of the most deprived areas in the city are in the north of the city, and there's a big piece of regeneration work happening there. So how can we make sure that we're getting affordable homes there and creating healthy places? Improving property management, particularly in the private rented sector, reducing rough sleeping and homelessness, maximising the provision of supported housing, and low and zero carbon affordable homes. 5 things, that's the what. But those things quite possibly would have been planned whether we did Making Manchester fairer or not. So where's the added value? What does this look like in practice? So an example, so in our task force, we have the lead from Manchester's housing provider partnership, so social housing. He's also the director of a social housing association. We have the director of housing from the council, and we also have the director of housing operations, so that's the council's own social housing delivery arm. That means in the room we're getting that dot joining, cross-fertilisation, relationship building, connectivity. So when the Housing Provider Partnership had their away day, they focused on making Manchester fairer, and they talked about health equity and how to make, what priorities they needed to do for housing. The council's housing strategy and homelessness strategy is now underpinned by making Manchester fairer principles. Within the work of the task force, we've done work that's joined up the dots between housing and poverty and racism and discrimination. A few highlights from things that have been done. So one of the new developments that's happening in the north of the city is going to have 30% of the new housing will be designated Manchester Living Rent. So that means the rent will be at or lower than the local housing allowance to make it affordable. In terms of safety and security, we've managed to bring the proportion of people who are living in temporary housing down by 12% over the past couple of years through some really deliberate work that I haven't got time to describe to reduce that figure. And then finally, in terms of housing conditions, so Michael, in one of his reports, talks about what's the sense in treating people's illnesses and then sending them back to the conditions that made them sick. So we've got a consultant now who's based in our local, public health consultant, based in our local acute trust, and he's worked with us and housing partners to develop a pathway for damp and mould. So for child seen in children's services in the hospital, and they're asked a question about their housing conditions, and it turns out there's damp and mould in the house, there's now a pathway whereby either the council or social housing, or we also work with private landlords, will look at the house and essentially sort the house out, whether repairs needs to be done or it's about deep cleaning. So action is done so that the thing that actually made the child sick is dealt with. So to conclude, where you live determines how you live. And I'm just going to end with two quotes that I think are really important to how we improve health equity. The first is from Marshall Gantz, who defines leadership as enabling others to achieve purpose under conditions of uncertainty. What is your role as everybody in this room as a leader to enable others to achieve what we need to do? And the second is from Nelson Mandela, who said, "It always seems impossible until it's done." Thank you.
Thank you. And I think it was Nelson Mandela who said, the opposite of poverty is not wealth, it's justice. Thank you. When we kicked off Leeds as a Marmot city, it was in June 2023, and they said to us in Leeds, we've got two priorities, children and young people and housing. And my response was, great, that's what we want to hear, what your priorities are, and we can work with you. We had an event a few weeks ago, sort of 1 year on. My colleague Tammy Boyce was very much involved in the Leeds work, and we had this 1 year on event, which for me was really exciting, the level of commitment from colleagues in Leeds of how to take this forward. I'm really interested to hear what you've been doing on housing, because it was a priority for you. So Tim, who's Deputy Director of Public Health, and then Adam will, from the development side, will tell us.
Thank you very much. And thanks, Cordell, and it's fantastic always hearing what's happening in Manchester. And for any of you that know the north of England, that doesn't come lightly to somebody that's from Leeds to say anything nice at all about Manchester. But it is fantastic, and we genuinely do owe Cordell and Manchester quite a debt gratitude from Leeds for the work that we've done. We started behind Manchester in terms of our journey around being a marmot city, and I got in touch with Cordell very early on, and she was very generous with her time, and it was really informative and inspiring hearing the work that they'd done, and certainly you'll see some parallels in terms of the work, because we've certainly taken and been inspired by some of the things they've done. I'm just going to spend a little bit of time just trying to give you a bit of an overview of Leeds and a bit of an overview of our journey as being part of a marmot city, and some of my reflections in relation to housing. And then I'm really going to hand over, and we've got a real benefit of having Adam here, who's a real expert in this area, who's really going to be able to talk about our approach to housing and the links to equity. So, for anyone that doesn't know, just a bit of context for Leeds. I mean, obviously it is the best place to live in the country, but we won't dwell on that. But Leeds is a big area. It's the second biggest authority in the country. We've got over 820,000 people living in Leeds, and it's really quite diverse as well in terms of its makeup. So we've got the city of Leeds, including all the sort of outer suburb areas. We've got quite a lot of rural areas, but also the outer sort of towns and villages. But similarly to Manchester, Leeds does have significant inequalities. You can see there with the red areas, these are the areas that fall into the most 10% deprived areas in the country, IMD1, and actually in Leeds that accounts for a quarter of the population, so a really significant amount, although we do have, and you can see they're sort of predominantly in the inner west and the south and the east of the city, but we do also have significant areas of growth and significant areas of wealth and affluence as well, hence the significant inequalities we get. So just down sort of south of the city centre, you've got Holbeck. Right up at the top, you've got Harewood. It's about 10 miles, and you're talking about 12 years difference in life expectancy between Holbeck going up to Harewood, just to give a sense of the sort of scale that we're talking about. But also, sorry, I'll just come on to the next one. This is the other one, and this is just related to that. And I really want, this is from our IHE data pack, which I'll refer to in a moment a bit more, but I always find this just really, really stark. And this is the population. This happens to be children, but it's exactly the same trend if you look at adults that fall into the 10 deciles of IMD deciles. And the starkness of that two-tier sort of population structure that we have, where a quarter of our adults, but a third of our children, and a growing number fall within that most deprived 10%, just really starkly, I think, illustrates the reality that we've got in terms of trying to address inequalities with that structural that we have. And when Adam comes up, he'll be able to talk a bit more about the challenges and the issues that presents from a housing perspective. We're really fortunate we started doing the marmot work. It's been a really exciting journey. It's been an absolute pleasure leading it, and I am so excited that we've now recently been able to publish, and IHE published the main report, so please would encourage people, do have a look. I think there's some interesting stuff that we've done there, as well as the main report, which is very concise. We've got data packs to accompany it, but also we've got the work that we've done to develop an indicator work as well. And I know other areas will have done it, but we've really worked hard about how we can have the right indicators to be able to demonstrate progress around inequalities, and critically be able to disaggregate those. So much of the time we have good levels of monitoring and data that we have within the city, but it always monitors everything at a Leeds level. So being able to have these critically broken down by IMD, by ward, by sex, by ethnicity is going to be really critical in holding that light to ourselves. I'm not going to dwell on this, but this just gives a flavour of the sort of shape of the work and the programme that we've done over this sort of first year and going into the second year. And as Sir Michael said, we've got two priorities that we've had alongside our overall approach and review work that we've been doing, and also the cross-cutting priorities. And you'll see there's a strong, we really sort of pulled on those early conversations with Cordell there, with the people's voice, and that tackling discrimination and racism in the work that we've taken into our approach too. But we've had this focus also on 0 to 5 and housing. And they came from those priorities from strategic conversations very early on in the origins of it. And I think just really illustrate how strongly felt. A lot of those were with elected members, and they really, really came across. This is what people are experiencing. This is what is occupying their time as local elected members, because this is what really, really matters to people in terms of their life. So, just a few reflections on the housing work we did. We started doing this with a sort of self-assessment of where we're up to. What became really evident immediately is how much work was already happening, and we certainly can't take the credit for all the work from the Marmot work we've done through public health. But what we also found was a lot of it was often quite fragmented and didn't necessarily have as much of an overall strategic approach as we might ideally want. And I think this just speaks to the sheer complexity. And one of the things I'm just going to really focus on is how hard this is at a local level, trying to do this health and housing work in big, complex areas because of the fragmentation and the complexity of the system. So even within the council, housing cuts across almost every directorate. You have housing sat in one, you've got regeneration sat in another, we've got housing work happening in adults and health, we've got more housing work happening in children's, and that's before you get to the housing partners, the third sector, and all the other sectors. But also, critically, much of the housing work can be driven and structured by lots of different things. So it might be by particular communities or age groups. It might be by particular geographies, so a particular ward where there's regeneration work happening. It might just be what funding streams are available that are accessible around retrofitted or insulation. But always, it also tends to be broken down by tenure. So things happen in social housing or private rented sector or owner occupied, which doesn't necessarily reflect the realities of the need at a population level. So from a public health point of view, we've had a phrase, from a Marmot point of view, sorry, all the way through the Marmot work about join up, scale up and be bold. And we've tried to bring that principle to the housing work as well, and trying to really sort of add value, join up and scale up the ambition around the health and housing work that's there. But critically also start from a population need point of view rather than a sort of service responsibility for a particular sector or tenure. And lastly, before I hand over to Adam, I just wanted to draw your attention. We've just published, as I say, the reports that I showed a minute ago, but also alongside that, we've got a specific set of recommendations on housing with a specific data pack that goes with that, and also one that's on 0 to 5 and with those as well. So this will be up online very shortly. I'm looking at Tammy any day now. She's pushing us to be able to press a button and upload that. So keep an eye out for that coming. Lots and lots of work going on that I haven't had time to mention. One of the, or two things I will just very quickly do. We do the selective licensing. That's been an area that's where we license landlords in private rental sector. Really fantastic, but we did identify that actually the links with health were really, really poor, so we've been getting involved to try and join that up and also to fill the gaps around some of the evaluation. And lots of work around things like hospital, housing workers in hospital supporting discharge, similar to Cordell was talking about, and some of the joint training. But I'm just going to hand over to Adam now, because one of our recommendations is about making equity a central focus of future regeneration and economic development plans and strategies in Leeds, and I think the work that Adam does absolutely embodies that. So thank you.
Thanks, Tim. So yeah, my role in the council is around shaping the future of the city, working with housing developers, housing providers, and securing delivery, choice and quality for our existing and future residents. And I approach this as a planner by training, and the historical reflection that I think town and country planning, the delivery of new affordable and social housing, the improvement of public health were fundamentally the same policy purpose about 100 years ago. And those areas of public policy have, I think, over time, unfortunately, separated and drifted apart. And at best, they work in parallel at the moment, but actually become probably quite disintegrated. And I was going to say that actually I'm not a public health professional, but I think the simple and fairly obvious revelation to me this morning is I am a public health professional, and anybody involved in that kind of work has to think of themselves in that way. So I think if I'm allowed a thesis for my few minutes here, it's that there is a need to fully reintegrate our approach to the delivery of new and improved housing, placemaking, planning, and the delivery of public health outcomes. I think an alignment and a coordination of policy, systems and funding, and I think crucially, a recognition of the imbalance we have between the available capital to address the causes of housing-derived public health challenges and the staggering amounts of revenue that we expend on addressing the consequences. So, just by way of context, we have a new government focus on housing growth, and I think pending what happens in the spending review, a new programme of social housing development. We welcome this in Leeds. It sits squarely with our inclusive growth ambition and our core mission to address poverty and inequality. And in terms of our spatial planning, we see this as a crucial tool in addressing the challenges of our inner city deprivation. 200,000 people, as Tim referred to, living in some of the poorest parts of the country in the worst conditions of housing and experiencing awful health outcomes that come with that. On the surface, we have, I think, a pretty good story to tell in Leeds about housing. Over the last 5 years, we saw 1.5% of the country's housing supply built in the city, including more affordable housing built, new affordable housing built than any other city in the country outside of London. Last year was a record. We built more than 4,400 new homes in Leeds, and again, a record of affordable housing for the last 20 years, nearly 700 new affordable homes. But when you dip below these headlines, it's clear we have a housing crisis. So we have 26,000 households on our housing register seeking affordable housing. Over 5,000 of those households are in acute need. And we generally can only rehouse or turn over our stock in Leeds at about 2,000 a year. Last year was the best year for 20 years, as I said, for affordable housing, but we've only built half of what we need every year to meet need. And in fact, our recent work indicates that for our next local plan up to 2040, we'll need to deliver over 2,000 new affordable homes in the city each year. So we're a long way from being able to do that. The system hasn't got the capacity or the resources to meet that need, despite the collaborative work we do right across the sector. And that's a simple fact that we know is replicated and scaled up right across the country. So affordability of housing is not just about the delivery of affordable homes, but it's a wider societal challenge. This graph shows the black line going across the middle, which is the median single household income in Leeds. And each bar that you can see is the income required by a household to afford the housing tenure that it reflects. From the most affordable on the left, which is social rent, through to purchasing on the open market to the right-hand side. What it shows is effectively in Leeds, half of all single earner households cannot afford to live in anything but social rented housing. And even we know that dual income households will struggle with average rent or indeed buying their own home unless they choose to disproportionately spend their income and sacrifice other areas of essential discretionary spend. So that's the invidious choices between renting, heating and eating. So improving the supply of high-quality, affordable housing is a serious matter of public health in Leeds to ensure that we meet basic needs of the population, to have a safe, warm, affordable roof over their heads, fundamentally underpinning everything we aspire to as a society. So I don't have time to tell you everything about what we're doing in Leeds to tackle this, but just to highlight that as a large stockholding authority, probably one of the largest in the country with around 55,000 homes in our ownership and management, we have a major impact on the housing experience and related health outcomes for many of our city's residents. We're challenged by a significant loss of stock under the right to buy. We lose around 600 homes every year. So sometimes it can feel a bit like filling a leaking bucket, but we are halfway through the delivery of a programme of delivering new council accommodation, 1,300 new homes, which are being designed to the highest viable environmental and thermal efficiency standards, incorporating often bespoke requirements for households in the most acute need, and being flexible accommodation that changes with the needs of families over time. We've taken difficult decisions on our end-of-life stock, around 600 homes being demolished and rehousing tenants, where there's actually no likelihood of those homes ever meeting through retrofit the standards required. And we're heavily investing in a £100 million programme of decarbonisation and connection to our district heating network, which will improve efficiency, reduce household energy costs, but fundamentally improve the life experience of tenants. But it is clear that we need a major injection of resources and capital to deliver the scale and quality of public housing that we really need to avoid this crisis deepening further. Around 22% of the city's 363,000 households live in the private rented sector, and Tim's already mentioned the work we're doing around selective licensing. We know that disproportionately for this sector, around a quarter of these homes are classified as non-decent, which can have a significant impact on health outcomes. Some of our poorest residents are paying the highest proportion of their income on some of the worst housing. And the images that you can see on screen there are not untypical of our kind of older terraced stock. Following targeted work in parts of the city in 2020, where we found that 85% of inspected homes were non-compliant with basic standards, and we secured improvements benefiting over 5,000 people, we're now consulting on proposals to roll out selective licensing of private rented properties right across our main area of 19th century back-to-back and through terrace properties, which will cover around 21,000 homes. And this will require landlords to sign up to a scheme that drives improvements in standards and joins up in signpost tenant services. And we know from our initial work that this has huge improvements to tenant health. So I'd just like to finish with a very quick case study focusing on our inner city neighbourhood of Holbeck, where we've tried to align our approaches to the health needs of households, housing quality and development, and thinking about those wider determinants of health in the neighbourhood beyond the threshold of the house. So Holbeck is an inner city community separated from the nearby successful city centre by the loss of industrial jobs, closure of traditional employers, and by legacy highway and rail infrastructure from the last 2 centuries. It's a very diverse neighbourhood, it's a very resilient neighbourhood, and has some of the highest levels of deprivation. And in fact, it's within the 1% worst neighbourhoods as defined by the government's index of multiple deprivation. 10 years ago, in the absence of any significant housing funding and amidst constraints on local authorities' ability to develop new homes, we instigated a major PFI housing programme, which included a major renewal and refurbishment and demolition of the Holbeck Council Housing Estate. And that was essentially addressing homes that themselves had been built as part of a slum clearance programme in the 20th century. This was strictly housing asset-based because of the financial rules that we were working to. So whilst we were kind of getting across the threshold to tenants, we could only really address the fabric of the building. But it did have some success, enabled us to achieve a big uplift in thermal efficiency and to address damp, mould and condensation issues. 5 years ago, we undertook a housing group repair programme on a small number of streets in a large area of the traditional back-to-backs, working with energy company obligations, with landlords and a cocktail of public funding to deliver whole house refurbishment on 300 single skin brick homes. And it's increased the EPC ratings from G to B, raised the ambient temperature of homes from around 12 degrees to 18 degrees Celsius, and reduced energy bills by up to 30%. This was, I think, incredibly resource intensive and very hard-won work, but with fantastic outcomes, but which are very challenging to replicate and scale up. And then 2 years ago, we submitted a bid to the government's then Levelling Up Fund that took all of this learning and combined it with the excellent work of a third sector community anchor, Holbeck Together, which is a safety net for many of the residents of that community, to take a whole neighbourhood and wider community needs approach. So this proposed a further phase of retrofit of housing, major improvements to public realm and green space, removal of rat running of traffic from the neighbourhood, and a significant enhancement of vital community infrastructure, including a social supermarket, new community work and meeting spaces, and new spaces for the delivery of community health services. So I think for many in Leeds, this is what true regeneration is about. It's about addressing the direct lived experience of health, home, street, and neighbourhood in a joined-up way. Needless to say, we're awaiting the outcome of the spending review to find out whether we get that money. So just in conclusion, and returning to my original thesis, hopefully in briefly relaying our experience in Leeds, I've illustrated that there are gaps in how we think about health, housing and place, and some of the ways that we can repair those and the clear public policy benefits of joining up.
Thanks all. We're now open for panel discussion. There, with any luck, there's a roving microphone. I can see a roving person with a microphone. So please comments, questions? Over there.
Thank you. The use of the word gaps is a great segue into my question. We've mentioned London, Manchester and Leeds. We haven't mentioned the rural community at all. I represent Community First in Herefordshire and Worcestershire, and we are part of the ACRE network, Action for Communities in Rural England. We're currently running a programme sponsored by DEFRA, Rural Affordable Housing Enabler. And I wonder how we integrate the power of your argument into that across the nation. Thank you.
Is this on? Oh, yeah. Great, yeah, really important. And that's reflected actually in some of the priorities in the marketplaces, who are increasingly focusing in on rural poverty, exclusion, lack of access to services, and considerable issues with quality, affordability of rural and coastal housing. So it is increasingly coming up the agenda for us in the work that we're doing. We're working in Northumberland with some really appalling quality private, old, rural, private rental sector and home ownership housing in rural areas. So appreciate the comment, and I think it's absolutely central that we do think about those areas as well, and coastal homes as well. Thank you.
Thank you. Merryn Simpson from the Health Creation Alliance. It's really good to hear a session like this on housing at a conference like this, so really brilliant. I do have a significant background in housing, but the question I was going to ask is that, in my experience, there's never enough money to do what needs to be done in housing. It's the poor relation in services, if you like, and it was the first to be cut many, many years ago, as budgets reduced. And I just wondered the extent to which you felt as a panel that the lack of a national tenant voice is part of the problem. The Health Creation Alliance is currently engaged in a feasibility study on that. And I just wondered whether you think that that is part of the problem, because tenants aren't seen as advocating for, as part of the influencing architecture.
Cordell, I'm going to ask you about the tenants, and then I want to go to Leeds and to ask you, how much difference does a change of national government make to what you're going to do in Leeds? But Cordell first.
Hi, yes, it's working, okay. I would absolutely advocate for a stronger national tenant voice. I think particularly for tenants in private rental housing, I think what we see locally is that, not completely across the board, but on the whole, social housing conditions and quality are better, and where it's not, work is being done really proactively to address it, and we're working really closely together, whilst, as we're all aware of in this room, it's completely different in the private rental market, and it's just so diverse, and some quality is good and some isn't. And I think selective licensing schemes can help. So we have some locally, but a relatively small scale, it's not compulsory, it can make a difference. So definitely having a stronger voice nationally to influence how we can get better regulation of the private rental market, I think would be beneficial.
Thank you. And Leeds, what difference does a change of national government make to the housing question?
Well, I'll let Adam, if he's okay, to answer that one. What I would just say, just very quickly, is just to absolutely back up your point about the lack of resources and the significance of that, and how much I think that impacts this area of work. I've been really, really struck. We're coming from a health background. We know, and coming off the back of COVID, we know about the challenges and the cuts across local authorities, but across health generally, and we know about the sort of moral challenges of working in COVID in the health sector, but actually talking and really getting to know some of the housing colleagues better has really brought home quite the level of challenge they're working under, the job that they're doing under phenomenal day-to-day pressure. And, just reiterating some of those numbers that Adam talked about, that in Leeds we're talking around 26,000 people on the waiting list for social housing, of which 5,000 to 6,000 are in the most urgent categories, and we're only talking of a turnover of maybe 2,000 houses a year. So you can be on 2 to 3 years in the most urgent of categories. What that means for frontline staff in housing and managers who are dealing with that on a day-to-day basis is really, really tough. And when we're talking about health in housing, we're also then obviously talking about a health system which, although talks a lot about prevention, at the same time is talking a lot about having to pull back and do what its core business is, because it's so strapped in having to make those difficult decisions. So it's a very, very challenging context, but I absolutely agree with the sentiment about tenant voice.
A slight cop-out answer is we'll wait and see, I think. Clearly there's been some very bold statements made, which we hope will carry through into the spending review at the end of this month. This commitment to a major new programme of affordable housing building. Well, as a council, we are primed and ready to draw on that additional capacity if it's made available. We have housing association partners in Leeds, probably about 20 who are actively developing, who are equally very keen to get certainty of funding over a longer time frame, and to bring forward that regeneration that we need. I think there are some good indications of intent around the repeal of Section 21, which is essentially the kind of forced eviction or no-fault eviction of tenants, which places huge stress on our temporary accommodation situation. And in fact, in Leeds, we do a lot better than many other cities, but it's a systemic challenge for us. We promised some reform and changes to right to buy, which will hopefully fix that leaking bucket I talked about. And I think the planning reform will perhaps loosen up some of the pace at which we can develop housing in the system as well. So I think wait and see, but looks promising so far.
Thank you. Gordon Kay, Health Watch Croydon. It was really good to hear that you're talking about engaging with local communities and having resident representation groups. I just wondered a little bit about how you've built trust, because there's a lot of mistrust, and also manage expectations, because it's going to be a long process. And I just wondered how you infuse, if these things can start with great enthusiasm, but obviously it's a long-term project. So it'd be interesting to know about those positives and challenges.
Yeah, really important. And certainly in the work that we're doing, looking at the role of developers, lack of trust seems to be a huge issue. Lack of trust in developers and the development process from communities, from local government, and that's sort of carried through the system, and it's been a major block on building new homes and getting the right kind of homes in the right places. So I'm just flagging it up. It is something we're looking at in that report, and I think it's really important that trust is built between the private development sector, local government and communities, so that we get those homes that we all need. And one way to do that is much greater collaboration between the development industry, local government and community groups when thinking about what to build, where to build and how to build it. And we're particularly flagging up the role of public health, of course, in that process.
And if anyone had a strong enough stomach to read the Grenfell inquiry report, it was pretty clear that the lack of trust, which was well justified, everything the council did was to earn mistrust from the tenants. They just didn't care about the tenants. And when Sajid Javid said that would not have happened if it were a rich estate, it happened because it was housing poor people. And I've been sensitized to the issue of racism by the report that we did, and there's a strong suspicion that there is a key element of racism in the way the people who lived in the Grenfell Tower were consigned to nothing because of who they were, poor, racial groups, and so on. So trust is key. And to see that avoidable tragedy played out in that way is heartrending.
Thanks for mentioning Grenfell. I worked there myself after the fire with the support services. And the issue of trust and racism were just as present for the staff as they must have been for the residents. It kind of brings me on to a question around culture. And it's been great to hear the examples from the colleagues here today. But in my own experience, the biggest barrier I think I find in systemic work, which all of these major challenges require, are cultural concepts and which change from place to place and service to service and sector to sector. And I just wondered if you had anything to say about systems leadership, the training and development of public servants in terms of their role of bringing about cultural change to enable greater utilisation of all of the partners in the system.
So I guess if I speak to both of those two questions, which are sort of connected, so I think systems leadership is really, really important. As I alluded to in my talk, this is about you can't solve complex problems through individual organisations, agencies, teams, focusing on things through their lens. You've got to see bigger picture. It's not linear. It's I don't even know what to call it. I wish I had a diagram. It's a meta diagram of joining up dots, and therefore anybody who is trying to bring about any kind of change in this arena needs to understand how to enable systems leadership. For me, that comes down to relationships. If you want to change anything, including culture, you have to come alongside people, step into their shoes, understand what their priorities or goals are, understand why they work in the way they work, and gradually come to a point of shared vision and shared goals so you can work through and bring about change together. And that's when you get to that position where the sum of the whole will be greater than the sum of the parts, and different as well. In terms of trust, so I think the first thing is to acknowledge that the lack of trust is justified. And I think I got a sense during the pandemic that there was almost a bit of blame for people not trusting the sector. It's like, oh, they don't trust us, vaccine hesitancy, etc. There's a reason why people don't trust, and it's justified. That would be my first point. You need to care, as Michael said. I think then it's about listening and having a thick skin. So again, if I think back to work that I was doing during the pandemic around trying to improve vaccine uptake, there were forums where I, as a black woman, was going into meetings and forums where most of the people in the room were black. And I thought, well, I'm going to connect because the whole, you look like people, you've got similar kind of culture, etc. That did not happen, actually, because I was still from local government and people still didn't trust me, and I still got a lot of backlash, and I just had to see it through. So actually, it's not all going to be just because you want to listen and you want to work with people, it doesn't mean it's going to change overnight. You have to keep going. Listen and then act. So act on what people have said so that people can see the difference that them working together with you has made, no matter how small it is, and feedback. And then I think the final point, which connects a bit to the managing expectations bit, is just being authentic and honest. This is what we have been able to change as a result of working together with you, and this is what we haven't for X, Y, and Z reason. We've still heard, we still know it's important, but at this moment in time, for whatever reason, we can't make that happen right now. And actually, if you continue with that ongoing dialogue, over time, you start getting trust, building trust back, but it's not easy.
So I've been working with Leeds, and I wanted everyone to meet both Tim and Adam, and I just wanted Adam to reflect to Adam that he doesn't sound like most regen leads, does he? Does he sound like your regen lead? So Adam, for people going back to their places, and some of them will be local authority people, some of them won't, maybe they're NHS. How do they try and get their regen leads to sound like you? Because it's not just about trickle-down economics that, oh, if we just build 18,000 houses here, it will trickle down and eventually there will be 3 affordable homes. How to engage with people like you at a local level?
I often describe myself as a jack of all trades and kind of sitting in the middle of a Venn diagram that covers all sorts of different sectors and bits of public policy and how cities and places work. And I think that would be my recommendation, is to say that you're an expert at nothing, but pretty good at everything. And to understand the dynamics and the problems and the barriers, and have some humility about that, I think. And the way I would define regeneration, which is perhaps different to a lot of places, is it's not about the buildings. It's not about property. Property and assets and infrastructure are essential to deliver good regeneration, placemaking and planning, but they're only part of it. So we have this kind of three circles in Leeds about place, productivity and people. And regeneration is the kind of the response that blends all of those properly. So I guess my central message is not just about buildings, it's not about assets, it's not about places, it's everything coming together.
Thank you for the question, Tammy, and the response, which raises a very important issue. Cordell, in her response, and all through the days so far, we've been talking about systems, but individuals do matter. We've said that individuals can't do it alone, but having committed people, committed individuals, charismatic leaders do matter, and the individual commitment. So it's this interesting dialectic between getting the, so Adam's response wasn't me, Gov, it was the system. Tammy said, it was you. You did it. You know, you're a charismatic individual who's committed and driven. So it's clearly both, and getting that balance right. But it does mean, to take Tammy's words, people can go back to their local areas and be like Adam and make a difference. But the systems are important.
And if I can just say, and find your Adams, because it might be in regeneration or it might be in other areas, but there are, you know, I think great people in all areas which get this, and you're pushing on open doors, and I think there is something really about following that energy, and, you know, Adam's a great example of that with the regen work that we do and that housing work, and we've had to work harder to develop some of those other relationships, including in housing and in other bits of housing, but they get there. But I think, yeah, finding those people and really pushing on them equally.
Well, I think that, let me comment, if I might, that both Leeds and Manchester illustrate something really important, that many of us come at this from public health. Public health can't do this, but public health is important. Providing the knowledge, setting up the information systems, monitoring the effect of policies. And we've seen that Coventry, it was a charismatic chief executive of Coventry that did it. He's now in Oxford, and we are working with Oxford. He's a charismatic chief executive, but public health was very important in there, advising. And so I think what Cordell's doing in Manchester, Tim, what you're doing in Leeds, is really a very crucial role. There's another crucial player in this that we haven't mentioned. This network is actually funded by Legal and General. Legal and General, we've been working with them. The report that we did on the business of health equity, the Marmot Review for Industry, was asking the question, what can industry do? What can business do in this domain? Most people who are employed in the public sector, not in the public sector, in the private sector. Private sector is important. Quality of work, what you do. I was talking to somebody from the food industry yesterday and said, which side are you on? Are you on the side of making people sick and overweight and destroying their health? Or are you on the side of helping people to live healthier lives? one of the things Legal and General has done, apart from funding this network, is to put a fund aside, a health equity fund. And Pete Gladwell, who's, I'll get this right, the head of social impact investing. Is that, there must be, I got some of the words right, at Legal and General. Pete, could you tell us about the fund and what's happening?
Thanks. Thank you, Sir Michael. To Adam's point, I'm a public health professional who works in investments. So yeah, thank you. Just a brief update because many of you will be aware, Legal and General has set aside £3 million to invest in community initiatives that address health inequality across the UK. We've just been blown away by the response to the requests for proposals and expressions of interest. And so we're up to 1,500 expressions of interest from across the country, which is exciting, but producing some paperwork at our side, so please do bear with us. The proposals are all really high quality. We've just been really excited to see the opportunity to have that positive impact. Sad, of course, that there isn't more resource going into this area from around the country, and acknowledging that, you know, even £3 million isn't enough to tackle the nationwide need, but we're doing what we can there, and we're now working through those expressions of interest. Just to give you guys an update to where we've got to on that, we're reaching out to interested organisations currently, so you should get emails yesterday or today requesting further information. Particularly important for us is working with democratic institutions like local authorities and combined authorities. And so where you've indicated that the proposal is supported by a local authority or combined authority, we'll be asking to just see that support as well, and that acknowledgement of support. And also working with local and combined authorities to make sure that what we're funding is aligned with local need, which they obviously know far better than those of us who are sat in London or wherever else we are in the country. So we'll be completing that work, and then working with the Health Equity Network's advisory board to try to narrow it down to projects that we can fund, which we're really excited about. And we're looking at announcing those final funding awards in the new year. So please do bear with us in that period whilst we just work through that due diligence process. Just want to finish by thanking everyone for your interest and your support and engaging with us in the process. We're finding both this network and the funding are really important parts of the puzzle as we try to work out how we as a company can support this fantastic work of addressing health inequalities across the UK. And we're really inspired by the proposals that we've already read. So thank you for those who have taken the time to submit those proposals. If you've got further questions, there is an email address, healthequityfund@cafonline, cafonline.org, which should have been, you should be aware of that email address because it will be one you've engaged with already, but please do put any questions you might have in the direction of healthequityfund@cafonline.org, or do feel free to grab myself or my colleague Julia. Julia, would you mind just standing up so that people... So Julia at the back as well will give you very intelligent answers to any questions you might have, so please feel free to grab us over lunch. But thank you for working with us on this project.
Thanks, Pete. I'm just thinking of all those disappointed people from the 1,500 who applied. But it shows that there's a real thirst for doing this. This session on housing and health, I think, illustrated how important the different sectors are for health and health equity. How, to come back to Nick Robinson's question, how is it possible to make progress? And that's what we've heard. And in Manchester, Greater Manchester and Leeds, I remember hearing Andy Burnham interviewed, and he was asked, will a change of government make a difference? Well, I mean, yes, probably. Probably. I mean, it helps if some money is going into it. I think you talked about the planning system. That's likely to help. But what's been very clear as the work we've been doing in all these different places, no one has said, look, we can't do anything at the moment because there's no money. It just come back when we've had a proper funding settlement. Jessica showed a slide. If you read off that slide, that the areas, the local authorities with the shortest life expectancy had a 50% reduction in spending power per person. But nobody from those authorities said to us, look, go away, we can't do anything. You know, we've got our statutory requirements, so we can't meet those. You've all said, we're going to do the best we can with the hand with which we've been dealt. Our hope is that the hand will start to look a bit better as over the next years will start to look a bit better. But then it's going to build on that level of commitment and enthusiasm of showing what's possible right now. So really grateful. I don't think anybody could go away from this session and think, well, yeah, housing's an important issue, but what can we do about it? I think they'll go away and say, housing is an important issue, and by golly, there's a great deal we can do about it. Thank you, Jessica, Cordell, Tim, Adam, for a terrific session, and thank you all. And it's lunchtime.